I want to talk about the importance of safety within organizations and within leadership and the workplace. Again, safety being the first of SAMHSA's 6 trauma-informed principles. There's an old saying that hurt people hurt people. And as professionals, we really have a responsibility professionally, personally, and I would say ethically, even morally, to heal from our own past wounds, to minimize the risk that we might unknowingly cause more harm through our work. It's no secret that most of us are attracted to the helping professions because of our own past wounds, our own past traumas. And so we have a real responsibility to ourselves, to our organizations, and to our clients to heal, to engage in our own personal growth and our own therapy and our own healing. And I think this is particularly true for leaders, that in leadership roles, we have even more power and responsibility and risk for causing harm on large scales, in that we have a larger impact through our decision making. And so it's even more important that we're healing from our past wounds. So in thinking about safety in organizations, we have to consider that our staff and our colleagues, their sense of safety is going to impact their work. The safer our staff members feel, the more efficient they're going to be in their work, the safer they're going to feel in relationships, and the better they're going to be able to cultivate meaningful relationships with clients or customers and with colleagues. The higher their job satisfaction is going to be, the healthier the work culture is going to be, and the more committed they're going to be to the agency if they feel safe in that agency. Now, to really drill this point home and highlight the importance of safety in organizations, I want to talk briefly about a research study that Google funded that was called Project Aristotle. This was a 5-year research study, and Google, the company, dumped a ton of money into this research study, and they wanted to know, of all the different factors that impact organizations and teams across different disciplines and different industries, what's the factor and the element that most impacts team productivity? And to our surprise, or maybe not to our surprise, psychological safety was by far the most important quality. That the more safety workers felt in their organizations, in their departments, in their team, the more productive they were. So this is really important research to keep in mind. The trauma-informed principles are not just important in terms of ethics or because they sound nice, but they also really translate to improving the bottom line and the financial health, the productivity, and the success of organizations and teams in general. There's usually some sort of parallel process that'll take place between how leadership is cultivating or disrupting safety with their staff, and then how staff is able to cultivate safety with their clients or perhaps disrupting safety with the clients they're working with. So there's usually a bit of a parallel process there. If the leaders feel safe in the organization, they're able to help the staff feel safe in the organization. Staff is going to better be able to help clients and customers, community members feel safe in that organization. However, if leadership is constantly feeling hyper aroused and anxious, it's inevitably going to impact their interaction with staff members, and staff members are going to feel anxious and hyper aroused and unsafe, and that's going to trickle down and inevitably impact their interactions with clients and with community members. And it might contribute to clients feeling anxious or hyper aroused or unsafe. There's really been a number of different studies on psychological safety in workplaces that all highlight how it increases learning in a workplace, increases performance, and it actually lowers workplace mortalities. It's important that we're addressing all 5 layers of safety for our staff. Again, those are physical, emotional, and psychological, social, cultural, and moral safety. As a group worker, a group therapist, I'm often looking at organizations through the lens of group dynamics. And one of the ways I like to think about this is that in group therapy, all the group rules and group norms that we create are really there to establish a sense of safety and provide a container for the group work to take place. And in a similar way, in our organizational context, all of the organizational policies that we create provide a sense of safety and a container for the organizational work to take place. Whenever there's violations of policies and violations of ethics within organizations, it really is a violation of safety on multiple different levels, perhaps especially on a moral and social level, a psychological, emotional level as well. The moral, cultural, and social safety, even emotional safety, can be promoted through non discrimination and anti oppressive organizational practices. Safety in supervisory relationships really parallels the centrality of safety in the therapeutic relationship as it relates to psychotherapy context. So, when we're doing trauma therapy, any trauma therapist knows that safety in the relationship is going to be one of the most important qualities leading to successful outcomes in therapy. And I'd like to suggest that in a similar way, in our organizational settings, safety within our relationships in supervision with supervisees and employees is just as important, that it's going to be central to positive outcomes and success in our work together and in our supervision. Now, in group work, group cohesion is particularly important, and it has a determining impact on every individual within the group. And there's various research studies and meta-analyses being published that really highlight and validate just how important group cohesion is in group psychotherapy. That perhaps it's one of the most important qualities, if not the very most important quality for successful outcomes in group therapy. That the cohesion of the group as a whole impacts each individual within that group. And in a similar way, if we're looking at an organization as a group through the lens of group dynamics, we could argue that the overall group cohesion within an organizational team, within a department, within an organization, or within an organization as a whole is just as important. And so it would make sense for us as organizational leaders to take the time to spend the energy to devote the resources to cultivating cohesion within our team, within our departments, within our organizations. Now, there's some simple ways that we can operationalize this trauma-informed principle of safety within our organizations. Trauma-informed principle of safety within our organizations. And this is by no means a comprehensive list. And again, we have to define safety through the eyes of our staff. So the ways that we implement this trauma-informed principle of safety in our organization has to look a little bit different from organization to organization. But some simple things that work in many organizations include providing meaningful employee benefits, expressing appreciation to our staff, having wellness funds. We're setting aside resources that contribute to the mental health and well-being of our staff, having employee assistant programs, creating critical incident response teams and policies in case there's a crisis or a disaster within the organization, engaging in a culture of transparency from leadership about decision making and what's going on within the organization, discussions and actions related to equity and equality and diversity and social justice within the organization, celebrating staff successes and milestones, beginning staff meetings with a few seconds to ground, maybe even practice some mindfulness, take a couple deep breaths. We used to do this in an organization that I've been a part of for a while called Miramont Treatment Center. The beginning of every staff meeting, we would take 5 to 20 seconds maybe to take a couple breaths together in silence and ground ourselves, to have a mindful moment together. And it was amazing how just 2 or 3 deep breaths individually and collectively would really, at least for me as a participant, it would allow me to set aside and contain whatever was going on before I ran to the staff meeting, to quiet my mind, and to be fully present with the objective of the meeting at hand. So this is a really simple thing you can implement in your organizations as well. And providing other self-care services, reminders, and opportunities for staff, paid time off, vacations, flexible schedules, those kinds of things. Of course, the resources that an agency has are going to impact their ability to implement certain policies and provide certain benefits, and it's real. And regardless, there's always ways that we can be better, and we can be creative and implement some norms, policies, or just things that uphold safe workplaces and work cultures that don't require a lot of money or even any money. Really helps to involve staff in decisions about how we're cultivating organizational safety. In psychotherapy groups, one of the ways that we maintain safety for the group is through pre screening and assessment of new group members before they join the group. We need to make sure that they're appropriate for the group and that they're not going to disrupt the sense of safety for the current group. And in many ways, our recruiting and hiring processes as organizational leaders is uh, very similar to our pre screening and assessment process in psychotherapy. So when we're recruiting and hiring new staff, one of the things we might consider is this person going to disrupt a sense of safety for other people in our organization? So at this point, I want to have us pause for a moment and reflect on, in your own experience in workplaces, what exactly are the things that help you feel safest? And what are some really simple things that you can do or you can suggest to enhance the safety in your workplace for your coworkers, for your staff, for your supervisees?